Hello everyone, my name is Julia and my team members include Madison, Sarah, and Morgan. Our presentation focuses on mental health services on campus at Cal State University, San Marcos. Did you know up to 44% of college students report having symptoms of depression and anxiety, and these rates have increased since the start of the COVID-19 pandemic? Those who suffer with anxiety and depression have an increase in dropping out of college, not doing well in their classes, suicide, and substance abuse. Those at higher risk include low-income students, students of color, female students, students who identify as LGBTQ, students who are caregivers for children or other adults. 75% of students who struggle with depression and anxiety are reluctant to seek help. One study showed people refrain from seeking help because they are too embarrassed, would rather talk to friends or family, think it costs too much, and are unsure of where to go or who to see. However, 65.2% of students stated that seeking counseling services helped them stay in school.
There are many mental health services offered on campus at Cal State San Marcos. The school offers phone consultations which can be scheduled by calling the number on the screen. This 30-minute consultation will be with a mental health professional who will discuss any concerns you wish to address in order to determine the best course of treatment for you. Both individual and couples therapy sessions are available and follow a brief therapeutic framework. If the needs assessed indicate that a longer-term therapy is recommended, the student will then be referred to an outside mental health provider for continued care. Group therapy is another service provided at Cal State San Marcos, in which there are many group offerings available. These groups include, but are not limited to, academic support, Asian Student Collective, Conscious Connecting, dating and domestic violence support groups, and many others. Cal State San Marcos also provides many short-term 3-session to 10-session psychoeducational workshops on common presenting concerns such as adjustment, coping skills, stress, anxiety, and depression. There are start dates for these workshops offered each week so that students can receive help within a week's time. These workshops are designed to provide students with a quick, time-efficient way to maximize the services provided and work towards improvement in their distress. All Cal State San Marcos students who have paid tuition fees are eligible for these services. However, services cannot be provided to an enrolled student only when the student has received the maximum number of counseling sessions allowed during the current academic year, services are judged to be inadequate to meet the student's particular needs, service provision is judged to be professionally unethical, the student has misused or abused counseling services in the past, the student refuses to sign the consent for counseling form or to comply with other policies and procedures deemed necessary to meet legal and ethical standards of care. However, under certain circumstances, students who have withdrawn from classes or disenrolled from the university can still be seen with the director's approval. Listed here are the address and phone number for the student health and counseling services on-campus location. They are open from 8 a.m. to 4:45 p.m., Monday through Friday, and closed on the weekends. However, if you are in need of care outside of operating hours, there is an after-hours counseling line that is available 24/7. Calling this number will connect you with a counselor who is on call 24 hours a day to ensure that there is someone available at all times. Additionally, the Suicide Prevention Lifeline also operates 24/7. Available languages are English and Spanish. If you or someone you know is in a time of crisis, please either call 911 or call 988 for the Suicide and Crisis Lifeline.
Hello Cougars, my name is Morgan and I'll be helping you navigate your way through our counseling services website. To begin, you'll go to csusm.edu/counseling. Once you're on our main website, you'll see in the right-hand panel a command that will tell you to request a phone consultation. You'll click there, where you will then be prompted to call the Counseling Services Center at 760-750-4915. You can call Monday through Friday from 8 a.m. to 4:45 p.m. to schedule your 30-minute counseling session. And in that session, you will speak with our counselor to assess your needs and to develop a course of action for your treatment. On our main CSUSM counseling service website, in the right-hand panel, you may see a command that says Schedule an Appointment. It's not what you think. It's actually a link that takes you to our group therapy and coping skills series. There, we will offer group and special interest services based on race, gender identity, ethnicity, sexual orientation, as well as advocacy for those who have experienced sexual violence. We at CSUSM never want you to feel left out, unheard, or unseen, so please check out all of our services on our website at csusm.edu/counseling.
There are many mental health services available outside of CSUSM, and here we have a few listed. First, we have the San Diego County Access and Crisis Line, available 24 hours a day and 7 days a week. They can link you to local resources and be there for you if you're experiencing a crisis. Next, we have the National Suicide Prevention Lifeline, which can help you if you're having thoughts about hurting yourself. They can also give you advice if you think somebody you know may be having suicidal thoughts. Finally, we have the Family Health Center Mobile Mental Health Services. They will come to you if you need individual therapy with a licensed mental health provider. They can also provide referrals to specific counseling, such as substance abuse. Finally, we'll leave you with a few endorsements from students who have sought mental health treatment. First, Natalie says, I feel so much better knowing a professional is helping me with my depression. Next, Carla states, the counselors are so welcoming and group therapy has really helped me. Finally, Eric says, I'm active and can focus on my studies again. These students are thriving. They realize that seeking mental health treatment is normal and it's healthy. So if you're thinking about receiving help, please utilize these resources that we've talked about today.